We try to explain to them, okay, you do understand that you sent that from your cell phone, right? So they could still show proof that it was you, and you have your IP addresses from the email accounts, so people can still trace it. And then it can be embarrassing, and then maybe later on you don't want to defend yourself. So we try to get them to think of the long-term things. And then also, just to rewind back, you mentioned it's the importance of us talking to the teen girls, but also it's the responsibility of the teen boys as well. So that's another thing that we want to push. It's not just on the girls, it's the boys too. And if a teen boy, if he has a girlfriend or a partner, it's okay for him to ask, are you on birth control? And it's okay for him to support her in her decision to get birth control.
Okay. Listen, we have the professional on the line, Dr. Annette Mays, and she is working with all women with the Las Vegas All Women's Care Center. But especially, she's very interested in our teens. Hi, Dr. Mays. How are you?
Good morning. How's it going?
Oh, it's going wonderful, Dr. Mays. Listen, we're having a very good conversation here about teen pregnancy prevention, and we wanted you to chime in. What would you say what's going on here in the Valley and some of the things that we really need to be cognizant of?
Well, I think the teen pregnancy rate is definitely climbing. Here it is, at least. And I think education, which is what you guys are talking about doing, which is what is needed. And so, it's so important. We're going to have some health forums, and we really want our teens to come out to ask questions. Some of them may be afraid to ask questions, but we want them to ask questions so that they know what's going on and they know how to prevent pregnancy and STDs, all those things.
Yeah.
Cervical cancer, all of that.
Right. And Dr. Mays at the All Women's Health Care Center, you're seeing young women. I was wondering what is the age range when girls start coming to see you and with their parents to have that conversation and to get their checkups? What is your suggestion?
If you can get them in before they become sexually active, really just for a conversation, not for an exam. If they're not having sex and they're not having problems, they don't have to be examined, but just for conversation would be great. So that we can do some, pre-counseling about birth control and STDs and those kinds of things. So really it's going to vary from child to child because some kids aren't becoming sexually active until they're an adult and other kids are sexually active at 13. So, you kind of have to feel your child out, and if you think they're thinking about it, or if they are interested in boys, or they're talking about having a boyfriend, they probably need to come in for their conversation.
Oh, right.
And the conversation needs to start at home, for sure. That's where the first conversation needs to be, is, the parents having that conversation with them.
I know that's right, Dr. Mays. And Dr. Mays, can we just have the number again so that we can make our appointments to come to the Las Vegas All Women's Care Center?
It's 522-9640.
Okay. And also, I know you're having your health forums at your office. They're free, and the next one will be held in March, correct?
Yeah, the first Friday of the month, beginning in March, the first Friday of the month at 1 p.m., and moms can come in, women, children, anybody can come in, and it's just really to introduce our practice to everybody, but also to answer questions. It'll just be a sit-down, very casual question and answer kind of session.
Right. Well, I encourage parents again to come down to your office and what's so great, Dr. Mays, you are just so easy. Sometimes it's hard to talk to people, but everybody can talk to you, and people sometimes it's hard to find a doctor that you can really talk to, feel comfortable with, and